Thanks for coming back to Horse Talk Live. Our show today is all about equine acupuncture, and we have an expert with us, Dr. Meghan Wintermyer. Dr. Wintermyer, if somebody's just joining us, give us a brief overview of what acupuncture really is.
Acupuncture is one of the modalities in traditional Chinese veterinary medicine where you use acupuncture needles to stimulate acupuncture points to balance a horse and heal the horse through I don't know how else to say it. But,
yeah. Through using these needles on the correct point.
Exactly.
Okay.
Thank you.
So we know that there are these points that really matter, that mean something, can't just go stick in.
Right.
What exactly about those points make it an acupuncture point?
So the acupuncture points are typically areas of concentrated mast cells, free nerve endings, and arterioles. And when you stimulate that point, it sends signals to the brain to release hormones, to balance the horse, and to treat an area. So that's why I was saying you could stimulate an acupuncture point on the back along the last rib to heal problems with the stomach. Okay.
So how would you know, like, are the stomach problems something that you as a veterinarian have diagnosed, or is it something that you have picked up on through your scan?
Both. I've done both. I've had horses that had chronic weight loss problems, were very irritable, and just as a regular conventional veterinarian, you might have in the back of mind ulcers.
Yeah.
But then when I scanned the horse, all of what I would call the ulcer points lit up. And when I say lit up, it meant that the horse reacted to them.
Okay, so it was giving you a sign of pain.
Was trying to bite me, or was reactive, was doing the paniculus response where their muscles move really fast.
So ulcers is something we've talked a lot about on this show because a lot of performance horses suffer from ulcers. A lot of times because of the unnatural way that we feed them, all the hauling, the stress that goes into training. So how can acupuncture help ulcers when it's like a man-made problem?
So acupuncture can help balance the horse, but if I had a horse that had ulcers and it was either through scoping the horse or through scanning the horse, I would recommend either herbs, and there's a great one called Stomach Happy, or the only FDA-approved product is GastroGuard. I would recommend the owner start those two therapies.
Together?
Either or.
Okay.
Or together in conjunction with acupuncture, because you can stimulate, like I said, the stomach. And in the Chinese veterinary medicine, the spleen actually controls the entire digestive tract. So I would tonify or strengthen those organs through acupuncture.
Okay. So those organs would be functioning better in order to help the other.
I know it sounds crazy. But the other thing is that you can balance the horse, and maybe this horse has ulcers because it's stressed out all the time. So maybe behavior modification with acupuncture, which there are different points that you can use, or herbal therapy to balance the horse so he's not so stressed, so then he wouldn't develop the ulcers.
Okay, so what are some behavioral issues that you do see and that you can help?
I've had emergency acupuncture sessions where horses that were just plumb nasty, aggressive stallions that would leap out of the trainer's hands and try to attack any horse next to it. That's a pretty severe aggressive problem. So there's a point that's behind the ear called An Shen that you can do aqua acupuncture. In an upcoming video, we'll see an example of that. There's Dafeng Men, horses that are just plumb crazy. It's at the forelock. There's 3 points that you can do. It's called gold bead implantation, or you can place surgical staples there.
Really?
There's points in the ear that you can use. And in conjunction, once you have that pattern diagnosis, once you know why they're having the behavioral problem, you can prescribe the correct herb to help those horses.
So why they're having is the behavior usually from pain?
It can be from pain, but it can also be because of their personality. Maybe they had training issue that has quote unquote blown their mind, and they have what's called phlegm firing upward, which I don't want to scare anyone away, but basically they need to have their mind calmed. And then once their mind is calm, then you can go back on to regular training.
Okay, so unblocking or just kind of
Balancing. I would call it
okay.
balancing the horse, yeah.
Okay, can alleviate some of those negative behavioral issues.
Absolutely.
Okay.
And then also stimulating those acupuncture points that help with behavioral problems.
Okay, and you mentioned the herbs, and so is this something that always goes along with acupuncture, the use of herbs, or is that just something you like?
I like to call herbs daily acupuncture. You don't have to use them, but they absolutely help.
Okay.
You're going to shorten the number of times that you need to have acupuncture treatments with the addition of herbs.
Okay, so name off some conditions that would benefit from herbs.
Okay, so the horse that was attacking other horses, he had liver qi stagnation, so there's a product called Liver Happy.
Okay.
The horse who is crazy in its stall, not that it's aggressive, but say it's ready to go to a barrel race and it cannot calm down beforehand. There's one called Shen Calmer, and those two products, they're not going to lose their motor, they're not going to lose their athleticism, they're just going to calm their mind. If you have a horse that has laminitis, an acute case, I'd put him on hot hoof 2. If it's a chronic case, hot hoof 1. There's herbs for cancer, there's herbs for kidney problems, there's you name it, there's herbs for it. And basically, a conventional veterinarian can open up the herb book, could look for the disease pattern that they have, and you can prescribe the herbs.
So this isn't something we can just go to the health food store and...
No, I wouldn't, because not only can you help a horse with herbs, you can hurt a horse with herbs. You don't want to add a horse who's already hot herbs, or a horse that's already cold herbs. So.
And is it do you just put them on their feed, or?
Well, it depends. There are herbs that you can feed.
Okay.
There's herbs that help with hoof pain that you just apply to the coronary band.
So some topical treatments.
So topical treatments, exactly.
Okay. And then what about herbs for just general pain instead of using an NSAID?
There's a great product called Body Sore that is kind of Robaxin and Bute combined. But as an aside, you can't use every herb for every horse. There are herbs that will test. So if you have a performance horse, yes.
Okay.
So you have to work with your veterinarian.
Yeah.
You can't just call up the pharmacy and say, I want this herb. You want to make sure you're on the right herb and make sure that you're not giving a horse for, say, a pregnant horse, a horse that is a stasis breaker. And because they say that pregnancy is the #1 stasis, you wouldn't want to prescribe a horse and then cause a problem.
So something that alleviates pain like this, is it going to be safer for, typically now when it's the right herb for a horse, there's a lot of problems or can be problems with the NSAIDs.
Absolutely, absolutely. So with if you are thinking of gastric or colonic ulceration, absolutely the herbs are going to be a great alternative.
Okay, and you'll just have to find out if your vet is herb savvy?
Exactly.
Okay, and where did you become so
herb savvy?
Yeah.
I became herb savvy at the same place that I went to school for acupuncture, the Qi Institute.
Okay.
Yeah.
And so every herb is going to affect every horse different,
and you're going to want to have the correct diagnosis before you put any horse on an herb.
Okay.
Just like I wouldn't want to give you phenobarbital if you didn't need it.
Yeah.
It's the same principle.
Okay. So you mentioned laminitis, and a lot of folks unfortunately have to deal with this in their horses.
Yes.
This is obviously, again, where being a veterinarian is so important in that condition. It's a terrible condition for a horse to go through. So how are you using acupuncture in conjunction with conventional medicine to treat laminitis?
So laminitis is one of the rare instances where I would use acupuncture on a daily basis. And it's called hemoacupuncture, and you actually use regular needles to let blood out along the coronary band at appropriate acupuncture spots. And it's amazing. You'll see the blood go from brown to the bright red. In addition to that, you can start him on hot hoof too, which is an herbal supplement.
Okay.
And the 4-herb salve, which is a pain relief salve that you put on the coronary band, in addition to your normal laminitic protocol, whether it be NSAIDs and DMSO and putting them on sand or whatever you normally do as a veterinarian, add to your traditional Chinese veterinary medicine.
And for the most part, you would see a relief in some pain?
Instant pain relief.
Okay. And how do you tell with the horse like that? Just physically, like in their expression, or?
You can see in the horse's body expression, in the way that they're standing, the horse will start licking its lips, will start yawning, their eyes will become softer.
Okay. And could you use it on for laminitis, for all of their feet? Is it?
You can. The horses that are typically, the horse usually are only laminic on the front feet, but you absolutely can use it on all 4 feet. You can use it on horses that have chronic laminitis, horses that had an acute phase and now are just battling with it on a chronic basis. Those horses, I wouldn't do a daily acupuncture, but you can use it for pain relief. And you can also support in TCVM, the liver controls the hoofs, so you could tonify the liver to help, to help support the feet.
Okay, and so where are the liver points then that you're?
It depends. There are points on the back that you can use. So
to enhance the liver function.
To support the liver.
Okay, and then in turn.
Exactly, and there's a great point that's for stagnation is liver 3. So you can either use liver association points on the bladder channel, or you can use liver specific points like liver 3 that's good for stagnation, which is on the hind leg.
So would you kind of experiment then to see which of those liver points would best benefit that laminitic horse? Or do you, how would you know which horse would benefit from?
I would have my plan. I would put all of the needles in that I thought the horse needed. Then I would stand back and think, is there anything else? If I'm not getting the response that I would expect, I would think to myself, is there anything else? And from there, I would change my course. But usually, after a while, you just know what you need to do.
Okay. Well, it's so interesting. We're going to take another quick break, but finish talking about acupuncture with Dr. Meghan Wintermyer when we come back from this break, so stick around.